please, can we please stop disgracing ourselves?
Now, for people in the rural communities, in spite of being in the Federal Capital Territory, we like to call them satellite towns. Are they going to enjoy this? I mean, I'm reading this, and the pilot stage for the emergency medical services is starting in the FCT. It's applaudable. But are we going to see people in Gwagwala that get this? Are we going to see people in Kwali enjoy this?
So what is applaudable?
It's applaudable that we're
their mouth and says, oh, well, we began. So, are you seeing anything that they began so far? So,
I have not done. I'm applauding for
statements. Okay. We're trying to make it a statement that
well, it's inciting some level of hope within me.
Okay, that's fine. But I will applaud them when I actually start seeing them. For example, how long do they want to do the pilot? Can you please update us? The people who are involved in this, update us. How far have you gone with your pilot? Okay, are you winning? Okay, when are you now going to start? Because first of all, it's a pilot, isn't it?
Right.
So you have to do a pilot. You make sure that it works. You correct your mistakes or whatever and stuff like improve on what you're doing, and then you now get to a point and say, we are good to go. Now we can now scale up, isn't it? Now if your pilot has not worked, you're not telling us anything, and you're asking about people in Gwagwalada and Kwali and stuff like that. Joy, which answer am I not going to give?
because I want you to give me more hope that it's not just Maitama people. In case even when the pilot begins, it's not just Maitama and Asokoro people, and that people in Kwali would enjoy these services. It will be run in Buari and other hinterlands within the FCT.
I'm saying, I'm not taking hope from anywhere. We must always remain hopeful. I keep saying this. Once we have serious governments and serious people running our affairs, and also the other part, once we have followership, and we have key players and key actors, that should be interested in this, rising up and asking key questions and putting pressure, because that's another problem. I think we have a very docile followership as well, very docile. Once these people keep asking, start asking the right questions and stuff like that, and start understanding that this is actually important too.
How about the medical unions? That's what I want to ask.
But I said the health professional associations. I talked about them.
No. You're talking about how docile the Nigerians can sometimes be.
But they are docile as well. All the health professional organizations, they are docile. I'm saying, if they are looking at me, I'm saying it to them now. They are docile. They are not focusing on these are the key priorities that we should be focusing on. They are not. Sorry. I will tell you the way it is. Okay? So, but what I'm saying is, I'm not taking away hope. I am saying, hey, can we as people, can we rise up? Okay, can we make our voices heard? Can we really focus on the things that are really, really important? Okay, and so when we start doing that, and we now start asking the key questions, hey, Federal Ministry, Federal Capital Territory Administration, federal government and stuff like that. How far with this your pilot now? Well, where's your pilot now and stuff like that? Are you guys doing well? Well, in terms of the issue of organizing, of coordinating, of making sure you have the proper human resource, of categorizing. When it comes to actually dealing with emergencies and stuff like that, where are you guys in this? Can you please give us updates? That's what they call strategic communication, isn't it? Can you please communicate us? Tell us, where are you? Okay, are you now succeeding in Asokoro, Maitama and stuff like that? Is it happening well now? Okay, it's happening well, fantastic. Now let's start looking at Kwali and stuff like that. If you're not doing well in Maitama and Asokoro yet, and Garki and stuff like that, going to Kwali and Gwagwalada, that's like you're just deceiving yourself. Okay, so please, Federal Capital Territory Administration, where are we with this pilot of emergency medical services in Abuja? Key question. And I really want them to actually answer the people of Abuja. Because the people of Abuja, they have a right to actually know what's happening. Because their health should be of utmost concern to the Federal Capital Territory Administration.
Thank you so much, Dr. Douglas Okor. Is there something you would like to leave us with? I mean, you have mentioned very important aspect of what they can start doing, the federal government and especially your health professional bodies, and how they can push forward, if for nothing else, the implementation of the National Health Act that ensures, our acts are often very, very concerned, very one. Our act, exactly, but it comes to implementation.
And have the political.
I don't know what that is. I don't know what that is. Exactly. But what would you leave us with before you go?
Okay, let me leave Nigerians and the citizens within the Federal Capital Territory with this: that things are not great at all when it comes to healthcare. Talk less of emergency care. Okay, we are struggling. Let's not lie to ourselves. So the fact that one episode happened and somebody came and make noise, it's good that we make the noise, because
exactly.
it raises the profile of such things, and we can actually start discussing it, and actually start seeing whether we can actually change the narrative. That's number one. Number two, please, I'm calling on the people that can put pressure. Okay, part of what I'm doing is actually trying to put pressure on the FCTA. I'm calling, and of course I will always call the health professional associations. Please do your due diligence. Rise up and start asking the appropriate questions, and of course other key players in the industry. And we need to keep doing this, Joy, because like I always say, the Nigerian patients
are worth it. The Nigerian patients are worth it. Thank you again, Dr. Douglas Okor, a consultant brain surgeon with the Federal Medical Center, Abuja. Thank you for being part of the program.
Thank you.
This is where we go join the Investment Plus segment, where we get to learn about our financial management tips, and when we return, we'll be talking about